Hi, my name is Saad. I'm a consultant in emergency medicine, and today I've been joined by Alex.
Hello, I'm one of the general managers in the emergency department at Leicester Road Infirmary.
And today we're going to talk about how to make an e-referrals using a nerve center. So Alex, talk to me about what is e-referral.
So an e-referral is an electronic referral made from nerve centre to other specialties in the trust.
So Alex, can you show me how to make an e-referral on the nerve center?
Yeah, so you double click on the task box and select e-referral. This is a test site, so there will be some diagnoses that are incorrect. You select the specialty that you want to refer to. So for example, CDU respiratory. So the first section is a priority. Is it urgent? Well, yes, because you're working in the emergency department, so all our referrals are urgent. You select the diagnosis. So here, this is free text for you to document the diagnosis of the patient. The reason for referral. So is it for advice? When would you like the specialty to give you advice, or over the phone or e-referral, that you don't require a face-to-face review for? Do you want the review in the department? Are you asking the specialty to come down to the department to see the patient for a face-to-face review? Are we selecting cross-site admission? Use this option for patients who require admission to the General or the Glenfield Hospital. Or same-day emergency care. Use this option if you would like the specialty to admit the patient to get reviewed in their area. For example, GPAU, GAU or EDU. So for here, we're clicking cross-site admission. Here you can document any notes relevant to the referral, and then your bleep and contact number for them to come back to if they need to. You then click Add. This then generates the referral on the taskbar in red, ready for the next area to accept.
Okay, so Alex, I can see now that the task has appeared on the nerve center in red. What happens next?
So me as the respiratory reg will have notification on my phone. The phone will beep until I acknowledge that referral. So when I've acknowledged that referral, I will then go in to decide what I need to do with the patient. I'll have 6 options to close the task.
Okay, and you would choose one of these 6 options after reviewing the notes of the patients, or maybe reviewing the patient physically?
Yes, so I may review the patient in the department, I may give advice over an e-referral or the phone, or I may actually advise to discharge the patient. But I will click that option on the e-referral to close the task to notify you.
Okay, and is that when the task becomes green?
It is, yeah.
Okay. I've noticed on certain occasions when you make an e-referral, it appears no one accepted or not assigned. What does that mean?
It means that the other specialty that you're referring to hasn't logged into their device.
Okay.
So that e-referral hasn't gone anywhere for
Okay.
anyone to accept. So you do need to escalate that to the flow manager available on site.
So Alex, what happens if the specialist that we wanted to review the patient in the department have not been down to see the patient?
So just to clarify, when you do put an e-referral on, you should put a pending bed request onto the specialty at the same time.
Okay.
A specialty should respond within half an hour to an e-referral, and if a specialist hasn't responded within half an hour, you can change that bed request to requested, which is the orange colour on Nerve Centre, only if the patient is stable enough to transfer to the ward.
Okay.
You can also use the flow manager, who is always available in the department 8 till 8, who can escalate this for you and speak to the specialist.
What about the specialties that are not using e-referral 24/7? What do we do then?
So when you make an e-referral, as you can see with oncology, for example, at the top of the e-referral, it will give you the service restriction. So for example, with oncology, you can only refer between 9 and 7. Outside of those hours, it will just be through switchboard, through the old traditional method.
So Alex, I know about the surgical specialties, there is a bit of difference in referrals. So how do we refer patients to surgical specialty?
So we have an in-reach consultant most of the time. When the in-reach consultant is available, you just go via switchboard and contact the in-reach consultant.
Okay.
Out of hours, when the in-reach consultant may not be available, you can either, if the patient is stable enough to just go directly to the area, you can put them on the surgical bed list. They will just transfer to the area then. If they're not stable or you feel you need a review in the department, you need to contact the surgical reg via the switchboard.
So we've set some ground rules around our SOP on e-referral. Rule number 1, e-referral is the standard and the preferred method to make referrals to other specialties.
Rule number 2. In an emergency scenario, you can contact your specialty via the phone rather than the e-referral in the first instance. You then retrospectively add an e-referral.
Rule number 3. When making a referral from ED, always select urgent.
So rule number 4. When making an e-referral, always write relevant clinical information in the referral notes. Always end the referral with kindly advise, kindly admit, or kindly review the patient in the department.
Rule number 5. So specialties are expected to action the referral within 30 minutes. When you make an e-referral to the specialist, put a pending bed request, and if they haven't been down or actioned the e-referral within 30 minutes, you can change the bed request to requested.
Rule number 7. If the primary specialty receiving the referral considers that another specialty is more appropriate to action the referral, then the specialty should refer the patient to the new specialty. Escalate to the flow manager or senior manager on call if a specialty declines to make that onward referral.
Rule number 8. Once you have made a referral, a name of a clinician should appear in front of offering to. If you made a referral and you see no one offered, it would mean that the specialist is not logged onto the nerve center device. Escalate the issue to the flow manager.
Number 9. When making an e-referral, select the most appropriate reason for referral. Advice, cross-site admission, same-day emergency care, or review in the department.
Rule number 10. All e-referrals must be closed, that is turned green by the specialty, once the referral request has been completed, that is advise, admit, or review in ED. Kindly escalate to the flow manager if the specialist has not closed the e-referral. Thanks for watching. I hope that answers most of the questions regarding e-referrals from emergency department. If you want further information, you can read our SOP, which is available on ED Insight, or drop an email to either myself or Alex, and we'll be more than happy to help.